Sciatica, SI joint pain, piriformis syndrome, all of these things can be extremely painful and debilitating, but with really good targeted stretching and strengthening exercises, it will feel so much better. So I'm gonna walk you through a quick routine that you can do every day that's gonna relieve a lot of that pain. Let's get to it. Okay, if you've got a pillow handy, go ahead and grab it because we're gonna use it for one of our stretches towards the end, but let's begin on your back with some pelvic tilts, okay? This is one of the motions that almost instantly takes some of that pressure off of your SI joint and in your deep hip. So laying on your back, you're gonna feel like there's this gap between your low back and the floor, kind of that natural arch of your spine. We're gonna remove that arch by tucking your tailbone under, and you should feel your low back connect down into the floor. And in this moment, just exhale, feeling your chest drop, feeling your belly drop. Go ahead and release everything, release the tilt, kind of re-engage that arch, not overarching, but let's go again. We're gonna tuck your tailbone under and exhale. You should feel your back firmly connected down into the floor, feeling that pressure beneath your back into the floor. We're gonna go two more just like that. Release your core, release your spine, tuck again. Tailbone comes under, low belly presses down as you exhale. Getting all the air out. And release. One more just like that. Tuck your tailbone and exhale. And release. Good job. Go ahead and heel toe your feet towards each other. So now your knees are almost touching. We're going to bring your right knee in towards your chest. And as much as you feel like you're able, we're going to squeeze that knee into your chest for a good, simple glute stretch. In this position, if you want to extend your left leg out along the floor, you can, but that might create more tension, more pressure through your SI joint. So you don't have to. So we're just squeezing that knee straight in. Deep breath here. And carefully release that foot down to the floor, kind of using that deep core muscle to stabilize your spine as you transfer from one side to the other. So now we're gonna bring your left knee in towards your chest, feeling that stretch. Make sure it's not twisting your body off to the left. Your spine should be staying level. Big exhale. If you need to kind of find the right angle in your hip socket, I always feel a little bit more comfortable when my knee is pointing up towards my shoulder, not up to my collarbone. And you might feel the same. So find whatever position feels the best for you, where you don't feel any locking or blockaging in that hip socket. Go ahead and release those hips back down. And release your spine off the floor. Okay, so now we're gonna do something kind of funky. We're gonna pull your feet up off the floor so that your knees are directly above your hips. And I want you to take your right hand and push into your right knee. Push hard into that knee, but don't let that knee move. So your knee is having to push back against your hand. Go ahead and release that. We're gonna do the same thing with the left hand on the left knee. Push left hand into left knee, push hard, hard, hard. You're gonna feel your core engaging, and then release. Let's do the right knee again. Push hard, 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 and release. Left knee again, push hard, and release. So now we're gonna go the opposite direction. I want you to take your right hand, bring it on the back side of your right thigh, and we're gonna try to push your leg away from you while you're not letting it go anywhere because you're holding it in place with that right arm. Go ahead and release that pressure. We'll do the same thing on the left leg. So clutch behind the left thigh, push your left leg away from you, hard, 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 and release. One more on the right side, push, push, push. This is just a really good SI joint reset. We're gonna combine these motions in just a second. Let's do left leg one more time. Push, 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 good. Okay, so now we're gonna grab on the back side of the right knee, so that leg is gonna be pushing away, and then we're gonna press your left hand. This is a bit of a coordination challenge. Left hand goes into the left knee, and we're pushing that way. So see if you can create those same motions. Push, 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 nothing is moving. and release. We're gonna do the other side, switch it up, press, 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 and release. Good job. So that's just like an isometric hold that can reset your SI joint. Feel free to revisit that one at any time you want. So let's bring your feet and knees close together so that they're squeezing into the midline of your body. Squeeze your buns. Try to squeeze your glutes really, really hard, and you might even feel that as soon as you squeeze your glutes, you're gonna get that instant relief from that SI joint pain, maybe even that deep hip pain. So we're gonna lift your hips up off the floor just about 3 or 4 inches, and then set the hips back down. Let's do that again. Lift, squeeze first and then lift. Actually, it's kind of a 2-step process. You wanna squeeze first and then lift. Do that again, squeeze your buns and then lift your hips. Set it back down. Let's go 2 more just like that. Squeeze, lift, set it down. 1 more squeeze and lift. Good job. Go ahead and walk your feet apart. So now that they're hip width apart, knees are now hip width. Same thing, same concept. We're just not as narrow. We're going to squeeze the glutes and lift. Basic bridge at this point. Do it again. Squeeze glutes and lift. Set it down. Do it again. Squeeze. Lift at the top of this one. Let's see if we can bring your knees towards each other. They might not be able to touch, but they might. Release them apart and then set the hips down. Let's do 1 more just like that. Squeeze glutes hard, hard, hard. Lift and then touch the knees together. Bring them apart and set it down. Great job. We're going to roll onto your side now. For a classic glute exercise, these are your clamshells. You may have done these before, but you may have done them wrong. So we want to make sure that your top elbow is down on the floor. That's going to prevent you from rolling open. And then this top knee should be slightly more forward than the bottom knee. Rest your head on your arms so you're in this nice kind of neutral, relaxed position. We're just going to pick the top knee up off the bottom knee without rolling backward. It's not a big dramatic motion. Set the knee back down. Let's go 10 of these. We're going to lift up. If you immediately get any cramping, just stop and pause for a second. You can even pause the video if you want and come back to these. You can stretch that leg out and just not lift quite so high the next time. Let's go 5 more. Lift. Helps if you exhale at the top of each lift. It's going to coordinate your deep core with those hips. 2 more. Release. Last one. Release. Good job. We're going to flip it around. We're going to do the other side now. Careful as you shift from one side to the other. Anytime your pelvis is uneven, that could create some of that pain through your SI joint, through that sciatica nerve. Okay, so we're finding the same thing on this side. So top elbow comes down. You're resting your head on your arm. Top knee is slightly more forward. So we're in this comfortable side lying position. Let's lift the top leg up and down. We've got 10 of these. Lift it up. It should only feel like a 5-inch lift. A lot of people, when they do clamshells, they try to go big, but it really is not that big of a lift, okay? So keep it small, keep it controlled. You might feel your bottom hip engaging here. That's totally normal. That side's gonna wanna stabilize the pelvis. We want it to do that. Keep going, let's go 4 more. Don't worry, we got a stretch coming. We're gonna stretch out these glutes. I know they're working hard, but you gotta remember the stronger your glutes are, the more engaged your glutes are. Let's go 1 more. The less pain you're going to feel through those hips. Go ahead and rise up. Now, this is where the pillow is going to come in handy, okay? You might not need it, but you might appreciate that you have it, okay? So we're in this tucked up position, what I like to call a 90-90 position. So your legs are kind of tucked in right at your sides. We're sitting on the left hip, and this is where that pillow can be helpful, where you can actually position that pillow underneath your left hip so you're not quite so deep into that stretch. So sitting up really tall, I want to make sure that you're not tucked under. We're going to tip your tailbone out behind you, and in that moment you might feel a strong pull, strong stretch deep in that hip socket. Okay, so we're just going to sit up tall, use your breath to lean you forward. You might not need to lean forward very much at all, and that's okay. Just working on that posture, that upright posture with your hips tipped out behind you might be enough of a stretch, but you should feel this stretch deep up into that hip socket. Let's do about 3 more deep breaths on this side. So your hip is going to be the happiest when it has a good combination of strengthening and stretching, okay? The stability piece at the pelvis is really important too. Let's go ahead and rise up out of that stretch, and we got to switch it up and do the other side. Okay, so release that pillow. We're going to flip it around, do the other side. Position that pillow underneath your hip if you need it. You might not need it. Once again, in this position, it's trying to tuck your tailbone under, so don't let it. Tip your hips out behind you, and we're just going to bring your chest straight forward. Working on good posture here at the top might be all you need, okay, to feel that deep hip stretch here. Big inhale. Exhale as you lean forward. Whenever you're stretching deeply, I don't want you to push into the pain where you feel your body fighting back. Sometimes that fight actually triggers a cramp, and it might backfire on you. So don't push too hard into your stretches. It should feel comfortable. Okay, ease up out of that. We got a couple more stretches I want you to try. You could use your pillow again underneath your knees if you need it. Otherwise, the mat is just fine too. So we're on your knees. We're going to extend your right foot out in front of you. We're stretching out your hip flexor. The tighter these hip flexors are, the more pressure it places on your SI joint, on that piriformis. So we're going to tuck your tailbone under, just like those pelvic tilts we did in the beginning, pressing your left hip bone forward. I don't want you to be dumping into your low back. That will actually hurt you quite a bit. So keep your tailbone tucked, glute is squeezed. Big deep breaths. If you want to extend even more, you can reach that left arm up to the sky and release. We're going to stay kneeling on this side, but take your right leg and extend it out. Tip your hips out behind you. You should immediately feel a hamstring stretch down the backside of your right leg. If you need to hold onto a wall, table, anything beside you, you can. Keep pushing your sit bones back. Chest is lifted. Once you feel the hamstring stretch, we're not going to hang out here. We're actually going to rotate your foot out and then rotate it in. Rotate it out, rotate it in, out, and in. One more just like that, and in. Great job. Okay, we're almost done, friend. We got just one more side to do with our stretches. So hip flexor first, tuck your tailbone, squeeze that right glute. Press your hip bones forward. If you need to deepen it, just reach this right arm up to the sky. Use your breath to release any tension. On the exhale is where you might feel your muscles relaxing, where they kind of melt and go limp. And we're focusing on those muscles right on the front of the hip socket. Go ahead and release it. Now we're going to extend the left leg. So same thing, those rotations on this side, but we got to find the good hamstring stretch first. So tipping your tailbone out behind you, hinging forward. You might feel that strong pull down your hamstring. And then in this position, we're just going to kind of rock on that heel, rotating in and out. If this is too much, just sit up a little taller. So far we have engaged the core, engaged your glutes, worked on stability, worked on posture, and worked on targeted stretches that will relieve a lot of that tension through your hip socket. Thank you so much for joining me for this quick strengthening and stretching routine. that really targets your SI joint, that piriformis, that sciatica issue that you have. Be sure to let me know how this felt for you in the comments below. I read every single comment, so I want to hear from you. Thanks again for joining me today, and I will see you soon.